is he? Jeez.
Okay. Hello, everyone. Welcome and thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you've called in via phone only, you can use *9 to raise your hand. In addition, please make sure to identify yourself by your full name and the organization or media outlet you are from prior to asking your question. With that, I'll turn it over to County Manager Mike Callagy.
Hello, everyone. Welcome to the Friday, May 1st session. I can't believe we're already in May, and we are headed to a month of, I believe, change. Again, I just want to stress is because of what everyone in this county and the surrounding area has done to shelter in place and adhere to the rules, that we'll move on to the next phase and hopefully another phase after that shortly. So the numbers, just we're approaching 2,000 positive, 1,200 positive cases. That's 1,200 positive cases. And unfortunately, we've had 3 more deaths since we last spoke, and it's now at 51 deaths in San Mateo County. The cases by zip code are up on the dashboard now, and we'll continue to update those. Is it once a week, Peter? Yeah, once a week that we'll update those. In regard to communications, we're widely publicizing the new FAQs about the shelter order that are available on the county COVID-19 website, and we've got it right here. Thank you, Michelle, and all the work that you have done and your staff has done to update the website. It's looking good, and we've got a lot of information on there. And I also want to thank David Silverman, who's on the line. Also, if you guys have any questions about the order itself, our legal from the county counsel's office, David really has been the one, him and his team have worked tirelessly on these FAQs and making sure that that information's up there. As you can imagine, there is a million questions, a million iterations, different iterations of this, and they are constantly challenged by new questions, but they are doing a fantastic job. Also, we will be participating in I'm sure a lot of you have heard about the Great Plate Delivered, the governor's Great Plate Delivered program. It's a heavy lift, but we will participate in that, and I'm sure Michelle will get more information out to all of you later on that program. Additional shelter capacity has been added, as we talked about, the Bayfront. Why don't we go ahead? You know, I think that I could sit here and talk about this program, but we wanted to show it to you so you get an idea of what's going on out there. I think individuals are way better than just words. So, Denise, if you can go ahead and roll it, and I think we should have.
Bayfront Station is a peninsula hotel where the County of San Mateo has leased 60 rooms for individuals who are experiencing homelessness, who are not displaying COVID symptoms, and are deemed high risk based on CDC guidelines. During the shelter-in-place time, individuals are placed here as a non-congregate shelter placement.
We are very happy and humbled to partner with San Mateo County to have this program here at Bayfront Station. This program is meant to work with those who are at risk and need isolation. And Samaritan House's role essentially is to be here to do intakes and understand the needs of the clients who are being referred here.
The guests here at Bayfront Station are expected to comply with the county's shelter-in-place orders. They can come and go as they please as members of the general public, but they would need to adhere to face mask coverings and also social distancing requirements.
We are happy to work with the clients to make sure that all of their needs are met, whether it be clothing, basic needs, food on site, and our staff are delivering that food and doing wellness checks with the clients who are coming in, and hopefully at the end of this have a good plan in place to make sure that folks are safe and secure.
Thanks, Denise, for that. And like I say, I just want to thank Samaritan House for all they're doing out there, and the Human Services Agency for creating this special hotel for our homeless so they can maintain safety and security during this crisis. It's a heavy lift to put that together, but well worth it when you think about the lives that you're impacting. And certainly we rely on our CBO partners, probably more than ever in these times of crisis, to really help us out, because we certainly can't do it alone. We value that partnership, and we certainly rely on that partnership. So what else do I have for today? Let's see. Reminders that property taxes are due on May 4th. I think that most people have received that message. County parks will also be open on Monday. There'll be 13 of them that will reopen on Monday. And of course, we'll be looking at and making sure that people socially distance. There'll be one-way trails in some cases. There'll be reminders to stay 6 feet apart. We'll encourage people to bring their masks to the park. They don't have to certainly use it while exercising, but if someone's approaching them and they're so inclined, they want to put it up, or they want to walk with it on, or they feel more comfortable walking with it on, we'd certainly encourage that. Just a reminder on the new starting times for Monday. 1:30 will be the starting time. Michelle Duran will send out information via Zoom. We did hear from Congressman Spear earlier today, and interesting to note that unemployment rate is now 10 times higher than the Great Recession of 2008. It was 600,000, now it's 6 million per week that we're seeing head into that. And really, again, for consumer confidence, for people to get back up and visit the shopping centers and the restaurants and stuff, there's got to be consumer confidence that we're testing and tracing, and all those things are being put into place. And I want to make sure that the public knows that we're doing our very best to make sure that we bring all the testing that we can to this county, so that we get to the point where it's on-demand testing to the extent possible. We've expanded it exponentially from where it was for everyone. Now is that first responders and those who work in hospitals and certainly residential care homes can get tested on demand. We hope to extend that to essential services employees, like those who work in grocery store, and then on to the general public. And certainly the general public can get tested now, but they need a couple of signs. We'd like to do it ad hoc and see to make sure that everyone has the ability to get tested who wants to be tested, because some are asymptomatic, and we want to make sure that we capture them also. So we will continue to monitor that. Also, we had spoken to Second Harvest Food Bank earlier, and they indicated that between the two counties, San Mateo County and Santa Clara County, they're up more than about 40%, serving 100,000 people more than they were before this crisis started. And that, to me, that's just amazing that they had to scale to that extent. But they're handling it, and they're doing a great job, and they're getting food out to people, and they're doing it many times a week. So we continue to rely upon their support and thank them for their support as we feed those who maybe don't have the money to feed themselves or their families. So on to the media questions. After new measures were employed, are there additional measures being employed to ensure testing and safety of the county's nursing homes and other similar facilities? How's the overall effort going? We just want to thank our medical team here for all they're doing, because, again, this is not a county responsibility. This is a county response that we are engaged in. We know that certainly these populations are our most vulnerable populations, and there is a necessity to test these folks, and we are doing that. We're going into these residential care facilities for seniors. We are working with the staff. Again, a lot of those staff have never expected to see anything like this, and would never expect to see anything like this in their lifetime. And to the extent that they are not trained or not comfortable, we are training them how to don and doff PPE. But this has got to be a main focus of ours going on. And I know that we'd love to see ongoing testing of our most vulnerable communities. And this is certainly one of them that we'd love to see ongoing testing as the testing becomes more freely available, and that we are able to get out there. but we are providing assistance, and it is ongoing to those residential care facilities. Question number 2, there has been discussion about reaching typically isolated communities such as those in nursing homes, the homeless, those in need of mental health services. How is that going? Clearly, we're doing a lot of work there and a lot of focus around there. We have still our street teams out there contacting the homeless. We're letting them know that we do have available space in the shelter. We have created a lot of space in the shelter by moving people out into individual hotel rooms who are most vulnerable. So we got the most vulnerable out. We are, maintaining, even though it's a congregate living situation, we are maintaining all of the norms necessary in today's day and age to protect people with social distancing and mask availability and hand sanitizing and taking care of food delivery and those type of things that you would typically see in a shelter. All that is being handled on an ongoing basis. The other vulnerable populations, we talked about the new governor's program, the Great Plate Delivered for our seniors and for those who are vulnerable. That is typically a way. There is a letter writing campaign and call-in service for seniors so they don't feel that the norms of isolation. Certainly, we have taken steps on the mental health side to be very creative. In though we maybe can't visit with people in person, there is phone calls going on. There is certainly opportunities to discuss with mental health professionals what they're going through. And many people are feeling isolation and desperation and despair because of where the economy is right now. But there are folks there to help them, and we will continue to make sure that we have those resources available to assist them. What challenges are rising in reaching those communities? I mean, really, it's difficult because of the social distancing necessity. That typically we would go out and ideally meet with folks, especially seniors, face to face, and make sure that they have what they need. But it's amazing how resilient a society we are and how we adapt to new situations that face us, and that's what we're doing now. And it's amazing that 6 weeks ago or even the last month to see that how we've adapted to doing business in different ways and how we're interacting with the press and everyone else. This is a lot of lessons have been learned from this. Some are very good that will probably stay in place long after this crisis is over. But some make us certainly more distant from those in need. In a lot of ways, we have come together by being separate, and everyone in society is pitching in, and that's what we've asked for at the beginning. That this is a heavy lift that's going to take the entire community to be involved in to get through. And it doesn't surprise me because I know the spirit of San Mateo County, how people volunteer and help each other and how they step up when people are in need. And it's just, this is a human spirit that we're just so proud of and so grateful to see in this county. Next question, has there been tracking of the types of calls 211 is getting and how is that changing? So we track calls daily. And as of 4:30, operators have received 5,600 calls, which is amazing. In the beginning, questions were largely about symptoms and testing, and now they're seeing increasing questions about essential businesses and rent and food assistance and testing availability. Some of that was also asking about gardeners and those other things that people really had on their mind. But the calls are being answered now in a very, very timely manner, where there used to be like these 12 and 15-minute waits. Now it's down to just really picking up the phone and calling. So we're very grateful for our partners at 211, and we continue to update them. And I know David continues to work with them on the FAQs, and that's been an absolute terrific system that has worked out and given people, a lot of cases, a lifeline as to where food can be found. And of course, on our webpage, we have all that information also. Next question, any progress on improving contact tracing and testing? So these are obviously the things we talked about in the past that are very important. Daily, we talk about testing and increasing capacity to test. We have put in a request to the state for more testing locations. We will see where that ends up. We will anxiously await that. But really on the testing side, it's the test kits that remain a challenge to all of us, and certainly to Verily, who's our main tester in this county. You know, we have asked to rapidly expand testing and to lower those requirements for people, those signs and symptoms for people to have in order to be tested. And you know, Verily, we're thankful for their partnership. They have been absolutely terrific, and they're here doing this, you know, on their dime, spending money in this county on their dime, providing free testing, and we so appreciate that. They are a victim of the supply chain also, and you know, we're all working to get enough test kits available to do the rapid testing for everyone. The contact tracing, we have worked on a model that in a rubric that really would tell us how many contact tracers we need. We do have some capacity right now because we have been building in capacity all along. It's, you know, this is something that certainly Health realized and knew very early, and they've put people in place. We will look to augment those who are already up and operational now and make sure that they are available. But we've got about a month. We have enough capacity right now if things were lifted tomorrow to get us through the next month. But we want to make sure that we have beyond what we're required to have. We have many people trained just so they can step in at any given notice. We never want to be caught off guard or have to play catch up. And that's been our whole motto throughout this whole crisis, is that we want to be ahead of the curve. We want to plan ahead, and we want to be ready when things come. And I think if you look back on all the things that the great folks in this county have done, it's really been in that theme. And they have been terrific, the EOC and Health and the Mohawk and the HSA, DOC, and certainly the JIC and everyone else has anticipated needs and done a great job on that. Any feedback on the zip code data? The only feedback I'd like to give all of you is don't rely on it, because it is truly meaningless data in the fact that it doesn't begin to tell a story of how many people are asymptomatic, how many people had it, didn't know it, or felt slightly ill, never got tested. We believe that it's much more, or many more people were infected than this indicates. So don't rely on it. It's kind of interesting to look at, but it truly is not something to be relied upon, or to say, oh wow, look at this. You know, I'm going to stay out of this area because there's more here, or I'm going to go to this area because there's less. It doesn't work that way. We've said from the beginning, we believe that it's entirely all over the county. Everybody should think about that every stranger they come in contact with, or even a friend or anyone else, they have the virus, and that you will use those universal precautions necessary to avoid getting it. Every cart that you touch, every door handle that you touch, you should think that way and use those precautions of washing your hands and making sure that you disinfect things that you bring into your house, especially if you have a senior in the house. And you really think about that, from the mail to groceries to everything that comes into the house. And with the SIP order changes going into place on Monday, are there enforcement plans for this weekend on those activities that will be changing? You know, our sheriff's office will certainly be on patrol, and as will the police departments out there. They know what's you know, proper and not proper, and you know, especially the beaches. We don't want to see people congregate at the beach. And we'll get into I'll just briefly go through some of these frequently asked questions that you know, that will go out. Can I go to the park? Yes, with certain restrictions. You can't play on the monkey bars or go on the swings or anything like that. But if you're out there kicking a ball in a field, yeah, sure, you can do that kind of stuff. Can I go to the dentist? Yes, they're classified as healthcare operations, and you should be able to go to them. And to the extent that your doctor wants to perform in these conditions, there's nothing wrong with that. Can I send my child to summer camps? Child care establishments, to the extent that they're open, such businesses, as long as they comply with the social distancing requirements set forth in the order, are okay. To the extent that you need more information, like I said, we've got David on the phone there that can answer that. And can my child play team sports? Can I play a team sport? The answer is no. If you cannot share equipment, you cannot play in team sports that are engaged in shared equipment. Can I go to the beach? you can, the parking lots are closed, but remember, there's certain provisions in the order which prohibit you from setting up camp at the beach, tents, umbrellas, chairs, all those things. If you want to go for a leisurely walk on the beach and you live within 10 miles, you can do that as long as you're not parking in the parking lot and you find a safe place to park. But the provision of 10 miles is in place, and people ask all the time, why is this 10-mile radius in place there? Others haven't done it, because what we have seen is that small communities have been inundated by people flocking to that location and congregating, whether it's in the restaurants that have served takeout, or the grocery stores to pick up lunch or whatever it may be, or even on the beach itself that we saw, in Southern California, for example. That was what was going on here, and that's why those orders are in place. So we are making progress. We just ask people to adhere to the standards just a little longer. We are getting to a point where we are opening up more. What we've done has worked, so just ask people to be patient and adhere to these orders for a while longer. Can I play golf? Yes, as long as you practice social distancing. And I think that in a couple of golf courses I spoke to in this county, they are well situated. They have this well in hand as far as maintaining social distancing. They've really thought this through, and they should. And I would tell you that I think every business should think this thing through in their idle time as to how they will operate once they do open, from every restaurant to every store. They should be putting plans in place now. So when those orders do come down, and we know that they will come down at some point in time, that they won't be scrambling to put plans in place, whether it's getting masks for their employees or making sure that they have lines set up or ingress or egress set up so people aren't passing. These are the things that people should be thinking about now if they own a business. How will they operate under this new normal situation where we will require social distancing and PPE? Can my house cleaner or housekeeper come to my house? No, is the answer. And we talked about the 10-mile radius. So with that, I will see if there's any questions.
Henrietta J. Burrows.
Yes, thank you. I'd like to get a clarification. I think I heard you say that the testing is available for all who'd like to have it, but you'd like to see symptoms first, and you'd like to get to people who are asymptomatic. And how can you get to people who are asymptomatic if people have to show symptoms?
Yeah, so it's just, let me clarify a little bit there. It's a little bit off. So we would love to get to the point where we can test people holistically, whether you have a symptom or not. We are not there yet, just simply because there is not a supply chain available that gives us enough test kits to do that. So right now, we're focused on those that are symptomatic. In fact, the requirements for 2 symptoms, unless you are a first responder or a healthcare worker, and that could be, a residential healthcare facility or anything like that. If you work as a first responder or a healthcare facility, you have the ability to have on-demand testing, so you can call up asymptomatic and go in and get tested. But otherwise, everyone else does need symptoms. And that is just simply a function of not having enough test kits. When that supply chain opens and we have an abundance of test kits, we really hope to get to the point where we can have a test for anyone who wants to be tested. And quite frankly, we hope then we'll be able to go through all the residential care facilities and test people on a regular basis, because that is our most vulnerable population. And those are the ones that unfortunately are passing because of this disease. So we want to get to that stage. We are not there yet. And we continue to work daily on trying to get enough test kits into this county so we can get to that stage.
Thank you.
You're welcome.
We have a chat question. Will the county provide information on deaths by zip code? Also, will the county provide more information / details on COVID deaths?
Well, I'm not sure about what more information you'd want on COVID deaths. The health director has been, health officer has been very clear he doesn't want to provide data on deaths by zip code. Again, I'm not sure how much information that really, or that information helps with, because you're going to find out where we have senior care facilities, you could have that really skewed because one senior health facility can have an abundance of those, and it will look like there's a lot of deaths in that particular city, and that's just not the case. It's just one location that seems susceptible to it because a facility was maybe overrun with the disease. So I don't think there's much value in doing that, but we can always ask again. But I mean, that's, I think, the standard answer.
I see no other chat questions or raised hands at this time. So if you guys want to take a final moment to enter any questions in the chat or to use the raise hand feature, please do so now.
David, anything you want to add? Anything on any clarity on the orders?
The only thing I would note, the two things I would note is one, well, three. One, you did a great job. Two, on the child care, currently it is limited to folks who can work under the order. And that really comes from, again, the state. The state has limited child care to essential workers, and we can't do anything in our order that is less restrictive than the state. So until the state changes its order, we're also stuck there. I did observe this morning that a major media outlet reported that that gardeners still can't garden, and that's not accurate. One of the main changes to the new order is to allow gardeners. Those are the only things I would add.
Great, and again, thank you, David. You have done a tremendous job on these. This has been a huge, heavy lift, not only helping to put the order together, but then to answer all the various facts and questions about this. It's just been a tremendous lift. So thank you. I want to thank everyone for being on today. May brings new hope. We are headed in the right direction. I think that we'll see a lot of changes in May because of all the good things that folks have been doing and being courteous and caring about others. So we look forward to seeing you next week at our new time, 1:30. 1:30 will be the new time next week. And until then, please stay healthy and safe. Take care.